So let's talk about something that can be a little confusing: bladder health tests. Specifically, we're going to break down two really important ones: uroflowmetry and urodynamics. We'll get into what they are, how they're different, and what they can tell your doctor about what's really going on. Ready? Let's dive in.
I mean, it's the big question, right? When something feels off, how do they figure out the root cause? Is it a muscle issue, a blockage, something with the nerves? Well, it's not just a guessing game. Doctors have some really clever tools to get a precise look at how your whole system is working. And it always starts with you. It starts with what you're feeling. That weak stream, that sudden gotta-go feeling, the annoying leaks. Those are signals. They're your body's way of saying, hey, pay attention to this. And that's what gets the whole diagnostic ball rolling.
So, where does the investigation usually begin? Well, typically it starts with the most straightforward step first. You can think of it as a quick, simple screening test to just get a baseline picture of what's happening.
And that test is called uroflowmetry. Now, the most important word here, the one you'll want to remember, is non-invasive. This test is basically just a really smart way to measure two simple things: how much you urinate and how fast it comes out. It gives a great, big picture overview of how well you're emptying your bladder.
And the process itself? It's about as simple as it gets. You just show up with a full bladder, and then you pee into what looks like a special toilet. That's it. A machine underneath does all the work, recording the flow. Afterwards, there's usually a quick, painless ultrasound on your belly to check if any urine got left behind. Simple, fast, and it provides a ton of useful information right off the bat. Okay, so let's just pause here for a quick comparison. On one side, we have uroflowmetry. It's non-invasive, it's a screening tool, and it only measures flow. On the other side, you've got urodynamics. This one's invasive, but it's considered the gold standard for diagnosis because it measures both pressure and flow. Now let's look at why you'd need to go to that next level. So, what happens when that simple flow test just isn't enough to solve the puzzle? For more complex situations, or when the first test shows something unusual, doctors bring out the big guns, the ultimate test for a complete picture. And that is urodynamics. See, now we're talking about a whole lot more than just flow. This test is all about measuring pressure. The pressure inside your bladder and even in your abdomen through the entire cycle, from filling all the way to emptying. It gives an incredibly detailed, dynamic look at the mechanics of what's going on. Now here is the really clever part. The doctor needs to answer a crucial question. Is your bladder muscle doing the work, or are you just straining with your stomach muscles to pee? Urodynamics solves this by using a second tiny catheter to measure that abdominal pressure. Then the computer just subtracts one from the other. What's left is the pure, true pressure generated by your bladder muscle itself. It's brilliant. So what's this actually like? Well, first, those tiny flexible catheters are gently put in place. Then your bladder is slowly filled with sterile water, and all you have to do is say when you feel things, like that first urge to go. Finally, you urinate like normal, just with the catheters still in place, so the sensors can capture all that vital pressure data from beginning to end. Okay, the tests are done. We've got the data. Now for the most important part. What does it all mean? What are the doctors actually looking for in all those squiggly lines and numbers? This is so cool. Even with a simple uroflowmetry test, the actual shape of the graph tells a story. A healthy flow creates a nice, symmetrical bell curve, but a long, flat line, like a plateau, can suggest there's some kind of blockage. And if the pattern is all choppy and stop and start, that could point to a coordination problem. Urodynamics, though, gets way more specific. For instance, it measures your bladder's actual capacity. You know, how much it can comfortably hold. For most people, that's somewhere in the ballpark of 300 to 500 milliliters. If that number is way off, it's a huge clue for the doctor. And this is where urodynamics really shines. It can spot conditions that are basically impossible to diagnose any other way. A classic one is detrusor sphincter dyssynergy. It's a mouthful, I know, but it just means there's a neurological mix-up. The bladder muscle is squeezing to push urine out, but the sphincter muscle, the tap, is squeezing shut at the exact same time. Honestly, there's no better way to describe it. It is literally like flooring the gas pedal and slamming on the brakes simultaneously. The body is fighting itself. You can imagine how that would cause problems. And a simple flow test can't tell this is happening, but urodynamics sees it plain as day on the pressure readings. And that's not all it can find. Urodynamics can spot a twitchy bladder muscle that spasms when it shouldn't, causing that awful urgency. It can identify a stiff bladder wall that doesn't stretch, a condition that can actually be dangerous for your kidneys. Or it can show the opposite problem, a bladder muscle that's too weak to squeeze at all.
Okay, so let's be real. We know urodynamics is more involved and invasive. So it's totally fair to ask the big question, when is it really necessary? And is it actually worth it? Well, the advantages are pretty massive. It's the gold standard for a reason. It gives the most definitive answers for tricky cases. And here's a huge one. It can identify high-risk problems before they cause permanent kidney damage. That alone is a game changer. Plus, with such a precise diagnosis, your doctor can tailor the perfect treatment just for you. But of course, you have to weigh the pros with the cons. It is invasive, and with that comes a small risk of getting a urinary tract infection. Also, being in a clinic isn't exactly a natural setting, so the results might not perfectly reflect everyday life. And for a very specific group of patients, those with spinal cord injuries above the mid-back, it requires extra careful monitoring for a serious blood pressure issue. You know, at the end of the day, it doesn't matter if it's the simple flow test or the full urodynamic study. The goal is always, always the same. It's about taking those confusing, frustrating symptoms and turning them into a clear, concrete diagnosis. Because only with a clear diagnosis can you find the right treatment that will actually help. And that really leaves us with a final thought to chew on. Tools like these represent a huge leap forward. They let us move past just guessing about symptoms. So the real question becomes, how can we use this amazing, detailed understanding to stop just managing bladder problems and start truly correcting them?